Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Social determinants of health significantly impact treatment outcomes and quality of life for patients with acute myeloid leukemia, or AML. Today, we look at some of the challenges facing this patient population and how patient financial advocates can impact their experience. Joining the show today is Linda Hayward, patient financial advocate at the University of Maryland Kaufman Cancer Center at Upper Chesapeake Health in Bel Air, Maryland.
When patients are financially underserved, it could be several reasons. One could be lack of insurance. Also, it could be the lack of the means to pay for insurance. We see that a lot of folks just can't afford the premiums each month for insurance plans. Another reason could be to be financially underserved. They don't have money for transportation to go back and forth to appointments. So the financial piece that really plays a major factor into a patient's getting their treatments.
What barriers are most likely to affect patients with AML?
A lot of the barriers that I see daily is just financial barriers would be when it comes to paying for their treatment. A lot of patients have high out-of-pocket costs for their treatments. Another barrier that comes to mind frequently is lack of transportation to get to and from appointments. We see that often.
How can a patient financial advocate help?
Patient financial advocates can help patients navigate different resources. One, we can help patients navigate health insurance, like looking for an affordable plan for them. We can also help looking into copay assistance or foundation free drug medications for patients if they can't afford the copays. And another thing we can also do is look into community resources to see if there's any transportation assistance or grants out there to help our patients get back and forth to their appointments.
What are some potential avenues for support for financially underserved patients?
Some areas for support for patients who are financially underserved, we look into compassionate use programs. That would be like the patient assistance programs for the free drug medications. We also look into copay assistance programs to help with copays for the drugs, and also community resources as well. We kind of tap into what do we have here locally and also on a national level from some of the bigger organizations out there.
What has your center developed to allow better access to treatment for these patients?
Our center, we try to take a proactive approach, and when our patients are newly diagnosed, we meet with them and let them know that they have a financial advocate and also a social worker, and we're with them on their journey. We help them from the beginning to understand their copays, and so that this way they know ahead of time their estimated out-of-pocket costs for treatments, and we work with our patients to get them enrolled in copay assistance programs or free drug programs to help lower their out-of-pocket costs. And then also our social workers do help out with more of the community resources as well for transportation assistance.
How have those been successful in providing more equitable care?
They've helped our patients get the care that they need. Our patients and our team members work closely together. Again, with applying for all these programs, if we weren't here to help our patients, a lot of them, they admit that they would forego treatment if they couldn't afford things. So we've really been able to step in and help our patients get the care that they need at an affordable cost.
Thank you, Linda. You can check out the show notes for helpful information on addressing disparities for patients with AML. Today's episode was made possible through funding by AbbVie. Finally today, if you're listening to the show on Apple Podcasts, the platform paused all its shows for regular listeners recently as part of an update. You can go to the Cancer Buzz channel on the app right now. In the top right corner, And if you see a pause sign, hit that, or hit the plus sign or downward arrow to make sure you're following the show and will get the latest releases when they drop. Until next time, for the Cancer Buzz crew, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.